Welcome to the School-Based Healthcare Services Training, Billing for Physical Therapy Services. This training is intended for physical therapy providers who participate in the School-Based Healthcare Services program. In this training, we will take a look at which providers can participate in the SBHS program, which students are eligible to bill for, covered and non-covered services, how to bill for and document your services, and how to provide and bill for telemedicine services. Please note that a PDF of this training with active hyperlinks is available on the SBHS webpage at www.hca.wa.gov/SBHS. SBHS Program Overview. The School-Based Healthcare Services, or SBHS program, is an optional Medicaid program which provides reimbursement to contracted school districts, ESDs, charter, and tribal schools for providing medically necessary health-related services to Medicaid-eligible students who receive special education services per an IEP or an IFSP. This program allows school districts to receive reimbursement for services that they are already federally required to provide per the Individuals with Disabilities in Education Act. The SBHS program does not cover all of a school district's costs for providing special education and related services, but it can help supplement the district's budget. School districts can use their Medicaid funding to hire additional staff, purchase assistive technology, or pay for professional development. It is up to each district how they spend their Medicaid dollars. The SBHS program is administered by the Healthcare Authority, or HCA. HCA is the state Medicaid agency in Washington, and it is also the agency that manages the health benefits for state and school employees. The main contact for the SBHS program is the SBHS Program Manager. Any questions about the program should be directed to your district's SBHS coordinator or directly to HCA's SBHS Program Manager. Many parents and/or schools worry that if their school district participates in the SBHS program, this will somehow affect services that students may receive outside of the school. Please note that receiving services through the SBHS program will not affect services that students receive outside of school. Eligible providers. The following individuals are eligible to participate in the SBHS program: Department of Health licensed physical therapists, DOH certified physical therapy assistants, and physical therapy compact license holders, and non-licensed school staff. Services provided by PTAs and non-licensed school staff must be provided under the direction of a DOH licensed physical therapist per their scope of practice with DOH and OSPI. The requirements on this slide apply to licensed PTs, PTAs, and PT Compact license holders. In order to participate in the SBHS program, PTs and PTAs must hold active and unrestricted licensure or certification with the Washington State Department of Health. PT Compact license holders must hold active and unrestricted licensure with a member state and must meet qualifications as outlined in DOH RCW and WAC. PTs, PTAs, and compact license holders must also have a National Provider Identifier, or NPI, and must be enrolled as a servicing provider under the school district's Provider One account. As stated on the previous slide, PTAs and non-licensed school staff must be supervised by a DOH licensed physical therapist per their scope of practice with the Department of Health. Provider One is Washington State's electronic Medicaid billing system. If you are a licensed PT, PTA, or PT Compact license holder, your district's SBHS Medicaid coordinator will need to collect information from you such as your DOH license number, your date of birth, social security number, NPI, etc., in order to enroll you as a servicing provider under the district's Provider One account. Billable services that you provide are then entered as claims by either the district's SBHS coordinator or a third-party biller. Although you are enrolled as a provider in Provider 1, you will not need access to the Provider 1 system, as you will document your services elsewhere. We will take a look at the documentation piece a little bit later on in this training. Non-licensed school staff providing services under the supervision of a licensed provider do not need to be enrolled in Provider 1. Any services provided by non-licensed staff are billed under the supervising provider's NPI in Provider 1. Supervision requirements for physical therapy services can be found on DOH's website, as well as in DOH RCW 18.74 and DOH WAC 246915. OSPI supervision requirements can be found on OSPI's website. In addition to DOH and OSPI supervision requirements, Medicaid requires that supervising providers review and sign off on any treatment notes kept by PTAs and non-licensed school staff. Eligible students. In order for a school district to receive reimbursement through the SBHS program, a student must have an IEP or IFSP with related services. The student must have active Medicaid coverage, and the district must have received parental or guardian consent prior to billing for services. Please note that school providers are not required to determine eligibility information. You should receive a list of eligible students from your district's SBHS Medicaid coordinator, or this information should be loaded into the documentation software provided by the district's third-party biller. If you are not sure if you should submit claims for a certain student, please contact your district's Medicaid coordinator. Typically, special education and related services are provided in the school setting. However, the SBHS program also provides reimbursement for services provided in the natural setting and in an alternate setting in accordance with the Individuals with Disabilities Education Act. If services are provided in a setting other than the school, providers must document this in their treatment notes so that the correct place of service code can be entered on the claim in Provider 1. Some physical therapy services are reimbursable when provided through HIPAA-compliant audiovisual telemedicine platforms as outlined in the SBHS program billing guide. Covered and non-covered services. The SBHS program provides reimbursement for IEP or IFSP evaluations and re-evaluations, as well as for the direct IEP or IFSP services, such as audiology, mental health, nursing, occupational, physical, and speech-language therapy services. As a school-based provider, you are often multitasking and doing many things in addition to service delivery. There may be additional activities that physical therapy professionals provide on a daily basis. However, Medicaid will only pay for direct health-related services provided directly to a student. Services such as attending IEP meetings, observation of a student, parent consultation, and reviewing records are not Medicaid billable services. Many of these activities are already built into the rate assigned to each direct service code. It is very important to remember that when you are documenting the time spent with each student, you only document the time spent providing direct services. Federal regulations state that physical therapy services must be ordered or prescribed by a licensed physician or other licensed healthcare provider within the provider's scope of practice. This means that for the SBHS program, licensed PTs and PT compact holders may evaluate, diagnose, and provide services without a script from a physician within their scope of practice, as outlined in the Department of Health. However, there may be situations when a physical therapist needs to refer a student to an outside physician, or a student may require a script from a physician for services. PTs should review their Department of Health regulations in order to ensure they are referring and providing services per their scope of practice. Medicaid does not pay for physical therapy services when prescribed or recommended by PTAs or non-licensed school staff. In addition, Medicaid does not pay for physical therapy services when prescribed or recommended by a provider if it is not within their scope of practice. Billing for services. When billing for evaluations or re-evaluations, there are 3 evaluation codes and 1 re-evaluation codes physical therapists may use. Even though time is associated with each evaluation code, evaluation codes are considered untimed. The times associated with the evaluation codes are provided as guidance for providers in order to determine which code is most appropriate to use. Providers must use their professional judgment to determine the most appropriate code to use. Providers may review the SBHS billing guide and the American Physical Therapy Association website for additional information on how to bill for evaluations. Licensed PTs and PT Compact license holders can only bill for an evaluation if the evaluation results in an IEP or IFSP that includes physical therapy services. For example, if you are asked to evaluate a student to determine if he or she requires PT services, and you determine the student does not require PT, even if an IEP or IFSP is written for this student, you would not be able to bill for this evaluation because the child does not require physical therapy services. If, however, you perform an evaluation and it is determined the student does require physical therapy services included in the IEP, you would then be able to bill for that evaluation. If additional tests and services are provided as part of the evaluation process, the provider may bill for these additional tests and services using the appropriate codes, which we will review on the next few slides. In order to receive Medicaid reimbursement through the SBHS program, physical therapy services must be included in the IEP or IFSP as either a special education, related, or consult service. The IEP and IFSP must state the frequency of services and who will be providing the services. If PT services are listed as consult, services are only reimbursable when the provider is providing services directly to the student. Consult services provided to another staff member or a parent is not reimbursable. The SBHS program will not reimburse for services provided in excess of what is written in the IEP or IFSP. For example, if the IEP states the student requires services 2 times a week, but the student actually receives services 3 times a week, the provider may only bill for 2 sessions as that is what is written in the IEP. However, makeup sessions may be reimbursable when the provider clearly documents in the treatment notes that the session is a makeup session, as can be seen on this slide. When providing services as part of group therapy, the provider can bill for the direct time spent with each student. In addition, when 2 or more providers provide services to the same student on the same day, both providers can bill for the direct time spent with the student. Providers must clearly document when services were provided as part of co-therapy or group therapy, and providers must only bill for the time spent providing services to each student. In order to record what services you provide, the SBHS program utilizes current procedural terminology or CPT codes. If you've worked in a hospital or clinic setting, you know that all medical procedures have a corresponding procedure code. There are literally thousands of codes available, but the SBHS program only utilizes about 20 physical therapy codes, which are listed in the SBHS billing guide. Providers should ensure they have access to the current SBHS billing guide at all times in order to ensure they are using the most appropriate codes for the services they provide. The SBHS billing guide and the SBHS fee schedule can both be found on the SBHS webpage. Providers must use their professional judgment when determining the most appropriate code to use for the service provided. HCA's SBHS program manager can provide guidance on SBHS policies and procedures, but cannot inform providers which code to use. Providers may seek guidance from the American Physical Therapy Association or a current procedural terminology manual for appropriate use of physical therapy codes. Some physical therapy services are billable when provided via HIPAA-compliant audiovisual telemedicine, as can be seen on this slide. More information about how to provide and bill for PT teletherapy can be found in the telemedicine section of the SBHS Program Billing Guide. All CPT codes are either timed or untimed. When providing services, providers should be aware of whether a code is timed or untimed to ensure they are documenting and billing appropriately. For timed codes, each measure of time as defined by the code description equals 1 unit. For example, code 97110 is timed for 15 minutes. This means that 1 unit equals 15 minutes. Please note that most physical therapy codes are timed. Untimed codes, such as 97150, are billed as 1 unit no matter how long the procedure takes. So how can you tell if a code is timed or untimed? Sometimes time will be listed in the short or long description of the code, but not always. Because the SBHS Billing Guide only publishes the short description of each code, a column to the right of each code indicates whether the code is timed or untimed. If the code is a timed code, the measure of time has been included, as you can see here for codes 97139 and 97530. If the code is untimed, the comments column will be left blank. This means that the code can only be billed once per day, per provider, per student. As you can see on this slide, even though time is listed in the short description of the evaluation codes, these codes are considered untimed and can only be billed as 1 unit regardless of how long the evaluation takes. As mentioned on a previous slide, most physical therapy codes are timed. This means that physical therapists need to be sure they are recording the correct time in and time out on their treatment notes, as this will determine the number of units billed on the claim. For codes that are timed per 15 minutes, a minimum of 8 minutes must be provided to bill for 1 unit. To calculate billing units for 15-minute timed codes, count the total number of minutes provided for the day for the eligible student and divide by 15 to convert to billable units of service per day. For example, if you see a student for 30 minutes and you submit a claim using timed 15-minute code 97110, you would divide by 15, which would give you 2 units of code 97110. In contrast to time codes, untimed codes are not reimbursed based on the time spent performing the service. Most untimed codes can only be billed as 1 unit per day, per client, per provider. Time in and time out must be recorded on treatment notes for all codes, even untimed codes. HCA will deny claims submitted with more than the allowable maximum units per day. The SBHS program follows the National Correct Coding Initiative, or NCCI policy. The NCCI policy was created by the Centers for Medicare and Medicaid Services in order to promote national correct coding methods. NCCI assists the HCA and the SBHS program to control improper coding that may lead to improper payment. The NCCI policy has 2 edits: procedure to procedure, or PTP edits. PTP edits prevent improper payments when incorrect code combinations are billed for the same client on the same day by the same provider. For example, codes 97110 and 97150 cannot be billed together on the same day when provided by the same provider to the same student. Medically unlikely edits, or MUEs, are the maximum unit of service a code can be billed for the same client on the same day by the same provider. For example, providers can only bill 1 unit of code 95852 per day per student per provider. If claims are submitted that violate the NCCI policies, claims will deny. In order to avoid claim denials, providers are encouraged to view the CMS NCCI website to ensure they are billing properly. If you've worked in a hospital or clinic setting, you know that in addition to procedure codes, each procedure also requires a diagnosis code in order for insurance to pay. The SBHS program utilizes one diagnosis code, R69, which stands for Illness Unspecified. As a provider participating in the SBHS program, you don't really need to worry about this, as this information is entered on the claim in Provider 1 by either the district's Medicaid coordinator or the district's third-party biller. You do not need to record the diagnosis code on your treatment notes. However, I just wanted to provide this information as a reference. Your school district may have additional time limits for when treatment notes are due. However, Medicaid's time limit for SBHS providers to submit claims are outlined on this slide. Providers must submit the initial claim to Healthcare Authority within 365 calendar days from the date of service. Within 24 months of the date of service, a provider may resubmit, modify, or adjust an initial claim that was assigned a transaction control number. Claim submission is typically done by your district's Medicaid coordinator or your district's third-party biller. Documentation requirements. When participating in the SBHS program, providers must follow Medicaid documentation requirements, which requires providers to keep detailed treatment notes that justify all billed claims. Treatment notes may be kept in electronic or handwritten format. Treatment notes must be maintained for 6 years from the date of service. Treatment notes must contain the following information: the student's name, the student's date of birth, student's Medicaid Provider 1 ID, the date of service, and for each date of service, the time in and time out, the procedure code, a description of the service provided, child's progress to each service, and a note whether the service was individual or group therapy. Notes must be authenticated by the provider who performed the services with either a handwritten or electronic signature. So what does all of this look like in practice? Some districts will contract with an outside billing agent or third-party biller who assists the district with submitting Medicaid claims. If your school district contracts with a billing agent, you will keep your treatment notes in whatever software the billing agent uses. Some examples of documentation software include EasyTrack, Whammer, or Embrace IEP. As mentioned previously, supervising providers must review and co-sign any treatment notes kept by PTAs and non-licensed school staff. This can be easily done with the electronic documentation software used by the billing agent. After the treatment notes are reviewed and signed, the third-party biller then uploads the information as a billable claim into the Provider 1 system. The process is similar if your school district self-bills. With self-billing school districts, it is recommended that each provider within the district keep their treatment notes in a template, either handwritten or electronic, to ensure Medicaid documentation requirements are met and to ensure that the person who is entering the information into the Provider 1 system has all relevant information. Resources. If you are a physical therapy provider participating in the SBHS program, there are multiple resources available to you on the SBHS webpage. It is recommended that providers bookmark or save this page as a favorite. Resources for physical therapy providers can be found under the Resources section and then under the Service Provider subsection. Under the Service Provider subsection, there are 3 columns titled SBHS Billing Information and Fee Schedules, Trainings and Webinars, and Additional Resources. Under the billing information column, providers will find a link to the SBHS billing guide and SBHS fee schedule. Under the trainings and webinars column, providers will find a PDF of today's training, as well as other trainings such as SBHS 101. Under the additional resources column, providers will find a link to the NPI registry, as well as to the Department of Health. At the very bottom of the web page, providers can view past SBHS Gov Delivery notifications, as well as sign up to receive SBHS Gov Delivery notifications. SBHS program contact information can also be found at the bottom of the web page. One resource available on the SBHS webpage is the SBHS Billing Guide. The SBHS Billing Guide is essentially the program manual for the SBHS program. The billing guide is intended to be used by school district administrators, SBHS Medicaid coordinators, as well as providers who participate in the program. The billing guide details how to bill correctly for SBHS services, including current billable codes, documentation requirements, how to bill for telemedicine, etc. The guide also lists SBHS covered services, non-covered services, information on program monitoring, eligible provider types, eligible students, etc. In most cases, answers to frequently asked questions can be found in the SBHS Billing Guide. A link to the current and past versions of the guide is available on the SBHS webpage. Providers may print out a copy of the guide. However, it is recommended the guide instead be accessed and viewed electronically. This ensures the provider is viewing the most recent version. In addition, there are active hyperlinks throughout the guide, which can only be accessed if viewing electronically. The SBHS program sends out email notifications via Gov Delivery. Providers are encouraged to sign up to receive SBHS notifications to ensure they are kept up to date on program updates and changes. Providers can sign up to receive SBHS Gov Delivery notifications by visiting the SBHS webpage and clicking on Sign Up for Email Notifications found at the bottom of the webpage. Providers may also view past program notifications by clicking on View Past Program Notifications. Please note that if you are trying to view past notifications on Google Chrome or Microsoft Edge, you will need to install an RSS feed extension in order to view the notifications. Directions on how to do so can also be found at the bottom of the webpage. So we've gone over a lot of information on today's training. This is just a reminder that all of the information found in today's training can also be found in the SBHS Billing Guide. In addition, providers may find the APTA website as well as the AMA CPT website useful. This concludes the School-Based Healthcare Services Training, Billing for Physical Therapy Services. Any questions about today's training or the SBHS program may be directed to Shanna Muirhead, HCA's SBHS Program Manager, or to your school district's SBHS Medicaid Coordinator. Thank you and have a great day.